As international development disorder, intellectual disability, and global developmental delay, social communication skill may be defects among individuals with global level. Optimal delay or intellectual developmental disorder, but separate diagnosis is not given unless the social communication defects are clearly in excess of the international intellectual limitation. Unspecified communication disorder F80.9. The category applies to presentation in which symptoms characterize of communication disorder that cause clinically significant distress or impairments in social, computational, or other important areas of functioning dominate but do not meet the full criteria for communication disorder or for any disorder in the neurodevelopmental disorder diagnosis class. The unspecified communication disorder category is used situations in which the clinic choose not to specify the reason that criteria are not met for communication disorder or for specific neurodevelopmental disorder, and include situation in which there is efficient information to make a more specific diagnosis. Autism spectrum disorder, autism spectrum diagnosis criteria F84.0A. Persistent defects in social communication and social interaction across multiple contexts as manifest by all the following currently or by history. Examples are illustrative, not executive. See text. 1. Defects in social emotional reciprocity, ranging for the example from abnormal social approach and failure of normal back and forth conversation to reduced sharing of interest, emotion, or affect to failure to initiate or respond to social interaction. 2. Defects in nonverbal communicative behavior used for social interaction, ranging, for example, from poorly interrogated verbal and nonverbal communication to abnormalities in eye contacts and body language, or defects in understanding and use of gesture to a total lack of facial expression and nonverbal communication. 3. The defects in development, maintaining and understanding relationship, ranging, for example, from difficult adjusting behavior to suit various social contexts to difficulties in sharing imaginative play or in making friends to absence of interest in peers. B. Restrict repetitive pattern of behavior interested or activist as manifested by at least two of the following currently or by history. Example are illustrative, not exercitive. See text. 1. Stereotype or repetitive motor movement, use of objects or speech, e.g., simply motor stereotype, leaning up to toys or flipping objects, achulialea, idostrine, phrases, categoria phrases. It sounds like Italian. Autism spectrum disorder number 2. In situations on sameness, inflexible adherence to routine or ritualized patterns of verbal or nonverbal behavior, e.g., extreme distress at small changes, difficult with transition, rigid thinking pattern, greeting ritual, need to make same route or eat same food every day. 3. Highly restrict fixed interested that are abnormal in intensity or focus, e.g., strong attachment to or participation with unusual objects, excessively just a second, circumcised or preservated interest. 4. Hyper or hyperactive to sensory input or unusual interest in sensory aspect of the environment, e.g., apparent indifference to pain, temperature, advanced response the environment, e.g. I don't know what is e.g. by the way. Apparent identifies to pain, temperature, advanced response to specific sound or texture, excessive smiling or touching of object, visual functioning with lights or movement. C. Symptom must be present in the early development period but may not become fully manifest until social demands exceed limited capacities or may be masked by learned strategics in later life. D. Symptom cause clinically significant impairments in social, occupational, or other important areas of correct functioning. E. These disturbances are not better explained by intellectual development disorder, intellectual disability, or global developmental delay. Intellectual development disorder and autism spectrum disorder frequently occur to make diagnosis of autism spectrum disorder and intellectual developmental disorder. Social communication should be below that expect for general developmental level. Note, individual with a well-established DSM-IV diagnosis of autistic disorder, Asperger disorder, or pervasive developmental disorder, not otherwise specific, should be given diagnosis of autism spectrum disorder. Individuals who have marked defects in social communication but whose symptoms do not otherwise meet criteria for autism spectrum disorder should be evolved for social programmatic communication disorder. Specify correct severity based on social communication impairments and restrict repetitive pattern of behavior. See Table 2. Requires support. Specify if with or without accompanying intellectual impairments, with or without accompanying language impairments. Specify if associated with a non-genetic or other medical condition or environmental factor. Coding note, use additional code to identify the associated genetic or other medical condition associated with neurodevelopmental or behavior problem. Specify if with criteria catatonia refer to the criteria for catatonia associated with another mental disorder. P135 for definition. Coding note, use additional code F06.1 catatonia associated with autism spectrum disorder to indicate that the presence of the combined catatonia. Recording procedures. It may be helpful to note level of support needed for each of the two core psychotherapy logical domain in Table 2, e.g. requiring very substantial support for defects in social communication and requires substantial support for restrict repetitive behavior. Specification of with accompanying intellectual impairment or without accompanying. And we have a table here.